Alright guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Today I have a special guest who's been on my show before, Dr. Susan Creech. She's a dentist, magnificent, extraordinaire. Every patient I send to you raves about you because she does it a little bit differently. I mean, she tests the bacteria in your mouth, has checked mine, and really helped my oral flora tremendously back a few years ago when COVID kind of messed it up a little bit. But in any event, she's helped me a lot with that. And the reason I really wanted to talk to her today is because it's a very controversial subject, and I've never been able to get a dentist to really talk about it on the air with me, and that's fluoride, because it's a very controversial subject in the world of medicine, especially dentistry. So we'll explore it. You know, it's not like fluoride's the devil, but it does have its place, I guess, and it has its detractors. But so we'll talk about that a little bit. But first, Dr. Creech, tell me a little bit about your practice, how you're different than most dentists.
So my practice is located in Colonial Heights, and I have been there for about 14 years. And my practice just started, general dentistry, bread and butter dentistry, and has evolved into more of a holistic and comprehensive practice. And what that means is that I'm not just looking at each individual tooth. I'm looking at the whole mouth. I'm looking at the medications you're taking. I'm looking at how your teeth fit together. So in a sense, it's a bit holistic in that I'm concerned about how every tooth works with the other teeth. I'm looking at, have the teeth shifted over time? What is the bacteria that you have in your mouth? There's bad bacteria, which can, the bad bacteria, if there's too much of it, it can lead to bone loss and tooth loss. So I'm just looking overall at your entire systemic health.
I love your holistic approach to this, and thank God somebody's doing that, because really your mouth is the first part of your GI tract. Everything in integrated medicine, like I practice, starts with your gut. Mm-hmm. And the first part of your gut is your mouth, your oral flora. Mm-hmm. And your teeth can certainly cause a lot of damage to your whole system, not only your gut, which can set off autoimmune processes, but also your heart. I mean, if you have a lot of bad bacteria that's seeding your bloodstream, and that gingiva, I guess, is very vascular, easy to connect, it can seed your heart with bacteria, can it?
Absolutely. And so those are some of the things that we're looking for, is not necessarily what bacteria is in your heart, but what bacteria is in your mouth. And we do that through salivary testing and can make some recommendations if there is an abnormal growth of bacteria in your mouth that doesn't need to be there.
It's been really helpful for a lot of my patients and myself. But let's morph in a little bit to fluoride. Let's talk about fluoride because it's controversial. And as a dentist, most dentists love fluoride, and they're almost scared not to talk about it. Maybe you'll get kicked out of the American Dental Association after this.
Goodness, I hope not.
I hope you don't either. But let's talk about it a little bit.
Yeah, I'm going to present the good and the bad. And I get questions a lot about, why is there even fluoride in our water? Why don't we have a say in our public water system as to whether or not we want the fluoride? Is fluoride really good for you? Does it really keep you from getting cavities? One question I get a lot after a cleaning, I will ask a patient if they would like a fluoride varnish painted on their teeth. And patients will say, well, I get that in my toothpaste. Why do I need the additional fluoride? So I just want to back up and talk a little bit about why do we even have fluoride in our water, and who thought to put fluoride in our water? Mm-hmm. Mm-hmm. So where it started was back in about 1940s, and there was a young dentist that had just graduated from dental school on the East Coast, and he moved to Colorado Springs. He noticed that his patient population, which were children, they had brown teeth. They had pits in their teeth, but they did not have any cavities. So they had otherwise healthy teeth. And, he thought that was very peculiar. He suspected something in the water. Well, about that same time in Idaho, there was a community that noticed the same thing. And they had heard of this young dentist doing some research on it, called him up, had him, look at their findings. This community in Idaho had just connected had a pipeline that connected to a warm spring a few miles away. And then that's when they started noticing the children having brown teeth. But once again, no cavities.
Interesting.
So a third area in Arkansas, a town that was owned by an aluminum company, had the same finding. And the chief chemist of this aluminum company said, I'm going to do some independent research. Well, some claimed he did that because he wanted to make sure aluminum wasn't the reason that, he didn't want to be blamed for the brown teeth. So he did his own research with some new technology and found high levels of fluoride in their water. So he reaches out to these other communities that are seeing it too, and they say, let's test the water for specifically fluoride. In all three of those communities where the brown teeth existed with no cavities, guess what? High level of fluoride.
Wow.
And no cavities. So this is what led to cities starting to regulate the amount of fluoride that was getting into the water.
Specifically for cavities?
Yes.
Okay.
And the first place that had a water system that was regulated was Grand Rapids, Michigan. And after they put the fluoride in the water, their cavity incidence in children decreased by 60% and no brown teeth with a regulated amount of fluoride.
So is there less fluoride in it or more?
Less.
Less. So so if you get too much, it'll turn your teeth brown. Interesting.
Yes, and they called that Colorado brown stain. And so that is how it started, with water being put in, or fluoride being put in the water systems.
Is interesting.
And in 1999, I found this interesting. The CDC named water fluoridation as one of the 20th century's greatest public health achievements. But yet we have so much controversy over fluoride.
Yeah. Is it linked to lower IQs? I'm sure you're going to get into this, but that's what a lot of people think.
That is the most common thing you hear about fluoride is, especially in pregnant women. I do not want fluoride because of the neurological issues that can occur with fluoride. So there are papers written about high doses of fluoride. Almost every research paper you see on, on negative effects of fluoride are when there are high levels of fluoride. And some of those issues that it's been linked to is endocrine issues with the thyroid, the kidneys, the pituitary gland, immune system effects, and then, the one most common would be the neurological, lower IQ.
Interesting. I've always wondered why people that live in England have such bad teeth. Is it because they don't have fluoride in the water or too much, or because they don't have orthodontists in England?
I just don't think that it's as widely accepted to get orthodontics in England. I really don't know that. I don't know too much about the culture, but yes, you're exactly right. You tend to see people from England with their teeth aren't as straight as here in America.
Whenever I see somebody with unstraight teeth or bad-looking teeth, I go, "You're from England, aren't you?" And if they start talking,
yes, then you can really tell. Right.
It's not 100%.
Right.
But let me ask you a question. So, why do kids get so many cavities compared to adults? And maybe they need the fluoride then, but not as adults. Or what's your feelings about this?
Being a parent and seeing what my children eat, I try to control the candy, the sugar, the sodas, everything, but it is almost impossible. Everywhere they go, school, church, community events, whatever, there's candy everywhere. And, and they love it. It gives them a high,
sugar. They love sugar.
They love sugar. Well, I think, most adults are controlling the consumption of sugar, and they're not getting as many cavities, but also just the pH of your saliva, the pH of your diet has a lot to do with whether or not you are more susceptible to getting cavities.
Do you ever check the pH of somebody's mouth?
I don't.
That'd be
No.
interesting. to see. I know some people do, some doctors do, but I don't know, the utility of it unless they were going to give them baking soda, which has a lot of good things.
Right.
Matter of fact, baking soda is really interesting. There's some newer uses I've just come across for endurance runners that almost 2/3 of your endurance Olympic athletes this year were taking baking soda, because what it does, it neutralizes the lactic acid that you produce, and your muscles can do better. It's interesting. So it's a safe, approved PED, really. But
Right. And
anyway,
toothpaste even have
Yeah.
baking soda in it. And many of my
Yeah.
patients will tell me that they mix baking soda and water.
They do. Some people get a little GI upset with it. That's why a company has developed these beads in hyaluronic acid so it doesn't dissolve in your stomach. It goes on through the small
Interesting.
intestine. But I actually bought some to test them. But baking soda, I did do a podcast on that years ago if you want to look it up. But in any event, we're getting off the topic. I'm sorry.
No, that's all right.
But anyway,
That's
so
all right.
kids get more cavities because their pH, maybe their teeth are softer, and then they eat too much sugar.
And also, primary teeth or baby teeth, the enamel is not as thick as a permanent tooth. And so it doesn't take as much demineralization to occur in a baby tooth as it does in an adult tooth before you have, a large cavity. But fluoride is always recommended in most dental offices for children. But in my practice, I recommend that fluoride be used after every cleaning. And I do
You
that.
just paint it on?
You paint it on. It's with a varnish. And, and fluoride
It
is
won't turn your teeth brown.
it won't turn your teeth brown.
Okay.
And, you're not ingesting it. And, we have to remember that fluoride is a natural occurring mineral. It flows out of, it leaches out of rocks and soil, gets into the water system. And those communities that I talked about before, there was just no regulation. Now, it's regulated. So I don't think that fluoride is something to be afraid of in drinking water in a regulated system. The benefits of fluoride just far outweigh the bad. But I am going to tell you about an upcoming ingredient that I think will replace fluoride.
Interesting.
But I want to make sure that I give fluoride its fair share of time.
What about linking to low IQ? Is there any proof of that?
There are many papers that are researched with that, with high levels of fluoride. There are some papers that claim that the low IQ is because of fluoride consumption. But, most scientists are going to agree that the conclusions are weak. Oftentimes they're biased, depending on who has supported the study. Water filtration system companies oftentimes will pay for these tests to be done. So
you always have to look at the study. Where's the money coming
You
behind
do.
the study?
You
Is
do.
it true that some communities choose not to fluorinate the water?
There are, and I did a quick search on several different water systems in Tennessee, and I don't remember specifically which ones, but there are some in Tennessee that are not fluoridated.
Interesting. How does that come about? Because of activism within a community, and they just approach the leaders of the city and say, we don't want fluoride in the water?
I really don't know.
That's
I
just
would assume
interesting.
that would be the reason in today's society.
Topic.
But fluoride, what it does is it binds to calcium and phosphate that is actually in the tooth and in the mouth. And it forms a hard layer called fluorapatite. And fluorapatite is what makes our enamel resistant to acid. So think about like a battery acid. Well, obviously we're not consuming battery acid, we hope, but it has a pH of 1. Well, guess what Coca-Cola Classic's pH is?
1.
2.4, 2.2. So, it's not that far off a battery acid.
That is
So if you have that layer of fluorapatite, which is the calcium, the phosphate, the fluoride, all combined together into a crystal, then that's going to make your teeth resistant to when you do drink that Coca-Cola Classic or, the acidic foods and drinks that you
Are
might
you saying
have.
we shouldn't drink Coke?
I'm not saying that because I do enjoy a good Coke.
I'll say it. I don't like Cokes, but I like them, but I never drink them anymore.
Well,
But
and just to be
that's
fair,
interesting.
Pepsi has just as
Yeah,
bad a
Pepsi.
low
We
of
have
a
to,
pH.
We have to give them equal
Yes,
billing here.
that's right. That's
Coke,
right. We're
Pepsi,
not
both
favoring one
real
over the
good.
other.
Yeah, not real good. How about Mountain Dew?
Mountain Dew's terrible. Terrible. But, the gold standard in dental schools is still fluoride. And it has been since like 1912. That is still taught. It was taught when I went 20-some years ago, and it's
well
still
ingrained.
taught today. But interestingly, on every tube of toothpaste or anything that fluoride is in, there's a poison control warning on it. And, if your child swallows a tube of fluoride toothpaste, you need to be calling poison control.
Really?
So it is toxic
That's
in
interesting.
high levels if ingested.
Wow. So if a kid ate a whole tube of toothpaste, you'd call the
Absolutely.
poison control. That is
Yes.
so interesting. So I've always told my patients the poison of most medicines and supplements is in the dose. And
Right.
it sounds like it applies here.
Right.
But,
And overexposure, can cause dental and skeletal fluorosis. So it gets into the bloodstream.
that is so interesting. What about, there's something, I don't know why, but I always choose fluoride-free toothpaste. But I hadn't had a cavity in years and years and years. But I also leave out SLS. I think it's sodium lauryl sulfate. Why is that bad for you? Or is it bad for you?
So sodium lauryl sulfate is a drying agent, and it makes the toothpaste thick, and so it dries out the mouth too. So patients that have dry mouth, we tend to tell them to avoid sodium lauryl sulfate. Some patients think that sodium lauryl sulfate causes ulcers in their mouth as well.
Yeah.
So
I used to get those. As a matter of fact, that's why I left it off. I used to get canker sores, which are called mouth ulcers, a lot. And interestingly, that's the reason I held off on taking rapamycin for a long time, because I was prone to those. And that's the only side effect that I have ever seen or heard about with rapamycin, the ultimate anti-aging drug. You can see a podcast on it, but it's really interesting because I've never gotten a canker sore since I started rapamycin about 2 years ago. So I think it has the opposite effect. So again, the poison's in the dose. With rapamycin, which is a phenomenally interesting substance if you look it up. And really the only people that come to me for it are really mostly physicians that have heard about it and researched it. But you have to do the dose once a week. But it's really
for how long?
For forever, as long as you want to stay healthy. Like most things, I always give it breaks though. Kind of like BPC or any of the peptides that we use, we give it short breaks, so you won't get tolerant to it. But so toothpaste, that's interesting. So I see a lot of Sjogren's, dry mouth with Sjogren's. So what kind of toothpaste would you recommend? Just something SLS free?
Yes. There's a Colgate brand that is a prescription strength that I tend to lean towards. It's called Prevident, and it's for dry mouth, but it still has fluoride in it, but it does not have sodium lauryl sulfate.
Interesting. What about the whitening toothpaste? Do they really work?
They do for external stains. And one of the new products that I'll talk about in a minute actually has a whitening benefit too. So I think that's another reason why this new upcoming ingredient is going to be popular. I know. I'm trying to build it up here.
I really want to hear what this stuff is, because I'm going to start using it.
Yeah. Well, I think as we leave fluoride and talk about something else, the takeaway is that fluoride has positive results for the teeth and for the oral health. In large doses, it is toxic, but it does remineralize teeth. It does reverse small cavities, and there is a place for fluoride still today in dentistry.
Interesting. So it reverses small cavities.
Yes.
I didn't know that.
It can remineralize
That
a
is
tooth.
Really interesting.
Yeah.
So the poison's in the dose. Okay.
Poison is in the
Remember that.
dose, yes.
Okay.
That's the takeaway. So the other product, the upcoming product, is called Hydroxyapatite. Have you heard of hydroxyapatite?
Yeah,
I'd say you have.
We use it as a filler called Radiesse in people's faces. And it's supposed to be natural, but yeah, we use it quite a bit.
Okay.
As a matter of fact, mostly as a cheek filler, for loss of volume as people age. But yeah, hydroxyapatite, which is a pretty natural substance. Isn't it?
It is. It's a natural occurring mineral form of calcium and phosphate, which our teeth already have calcium and phosphate in them, so it's easy to incorporate into the natural tooth structure.
So does it protect your teeth?
It does. It
That's
does.
interesting.
It has very similar action to fluoride. So our enamel has about 97% of calcium and phosphate, and our dentin, which is the second layer of the tooth, has about 70% of calcium and phosphate. So it's a familiar compound, and it absorbs into the teeth and it fills in the tubes of the teeth. So I brought a picture so I could really explain what I meant by that. So if you look here, this is an electron microscope of the dentin, which is the second layer of our tooth. And if you were to do a cross section of a tooth, let's say like right here, this is the tooth, and if we were to do a cross section here, this is our dentin, the brown part, and this is what we're seeing here.
So it's got a bunch of holes in it.
It has holes in it.
It's porous.
And what the benefit of hydroxyapatite is that it will fill in these holes. Okay.
Is that where cavities start, in these holes?
The cavities more or less start most of the time on the external surface of the tooth. The white part is the enamel. This is the dentin. And if you have a good layer of enamel right here, then it has to go through the enamel first into the dentin. Now, if you've lost your enamel by grinding your teeth or drinking acidic foods and erosion, you worn away the enamel, and you have dentin exposed, that's where your cavity is going to start. And the dentin is not as hard as the enamel.
So once you have a cavity and it eats through the enamel, gets into the dentin, then if it gets into the nerve, you're going to have a root canal, right?
Correct. That's right. But once it gets through the enamel and into this dentin, see these lines right here? These are those tubes I'm talking about.
That is
And
so
these tubes
interesting.
are what communicate with the pulp. And if you've ever put water in a straw and then you've held your straw up and kind of done your fingers back and forth, you can feel the pulsating water go. That's a very similar reaction to what is happening with the fluid inside of the dentin tubules.
That is interesting.
So hydroxyapatite and even fluorapatite is what clogs these, effectively, and it rebuilds and remineralizes this layer right here, makes it harder and more resistant to the things that we're eating and drinking.
Interesting. And it plugs the holes in the dentin? Is that what you're saying?
And it prevents harmful bacteria from attaching to the enamel. The hydroxyapatite does.
When you get an abscess, where is it going to be on this model?
So it's going to be down here.
Okay.
Most of the time it's going to be down here. Now they can be on the side of the tooth, but it's going to be where this nerve exits the root.
So it's going to hurt.
Yes.
Usually.
It's going to hurt. Usually, yes. Sometimes patients will have abscesses that have been there for years, and there's a draining fistula out through the buccal plate, the bone, and the tissue, and it's draining pus out into the mouth, and that's why there's not a large swelling. That's why there's no pain, because it's releasing the pressure, and the contents of the infection are pouring out on a daily basis.
So you're saying
but
a lot
think
of
about
people-
it. You swallow it, and where does it go? And then that's why it is so dangerous to leave bacteria and an abscess in your mouth.
So they may not be symptomatic necessarily.
Right.
And they may not have lymphadenopathy or tenderness. Wow. Is that why you like to do x-rays, to look for abscesses as well as cavities?
We find abscesses that are asymptomatic every day in our practice.
Are they amenable to antibiotic treatment?
You can give someone an antibiotic for an abscess, but it is going to return. And each time it returns, it's going to be a little worse, a little worse.
So you can't get rid of it by an antibiotic.
Right.
So you have to go in
So
there
you
and
have
do
to have a root
canal.
canal if the tooth can be saved. Sometimes an abscess has done so much damage to the bone around here that you can't save the tooth.
That is so interesting. So this hydroxyapatite, I'm really pumped up about that. Can they make it into a toothpaste?
It is. It's made into a toothpaste. It's made into a varnish. And the varnish, like I was talking about with the fluoride that we paint on the teeth after a cleaning, we can do the same thing with hydroxyapatite.
You do that in your office?
We do. Yes. So I like to offer both because, I'm not going to argue with you about fluoride.
Sure.
I mean, some people come
Yeah.
in and say they don't want it. Fine.
Yeah.
But let's do something to
Yeah, that
harden
is
our
awesome.
enamel.
I love your attitude about that because, like you say, some people really are convinced that it is harmful. And really I don't know how your practice is. In my practice, the ultimate decision is the patient's. I give them my ideas and information, but I think it's their right to choose what they get.
Right.
Even if they get nothing, that's their decision.
Right.
So you offered this, and so what's the name of the toothpaste that has this in it?
Well, there's several on the market, and the particular one that I like to use is Periosciences.
Periosciences. Okay, can you get that at your office?
You can,
or
and it's
internet, or can
right.
you okay.
You can order it online, but I carry it in my office as well.
I'd rather get it from you.
Yeah. So
I'm gonna reserve me a tube of that.
well, and you want to make sure too that wherever you're buying it, that it is a true Perioscience product, just like
Yeah.
any product that you would buy online.
Like you go on Amazon, you may not get the true stuff.
Exactly.
It's so interesting.
And I'll even paint either fluoride or hydroxyapatite on a patient that has some recession, if gum has receded down.
Which is most
for-
adults, right?
Right.
Past what age? 50 or?
Sometimes 30s or 40s, depends on if they've been grinding their teeth, depends on if they had, if they brushed their teeth hard. Lots of different reasons for recession, genetics as well. But I'll paint it because it's sealed. I'll paint the fluoride or the hydroxyapatite on the tooth because it seals the tubes in the dentin, and the pain is reduced for the patient.
For sensitive teeth.
For sensitive teeth. So that's a huge benefit of both fluoride and hydroxyapatite. As fluoride, hydroxyapatite also remineralizes enamel. And it also can reverse small cavities.
Why don't they put that
So-
in the water?
I don't know.
Since it's a less controversial. That's interesting. Maybe in 50 years from now it will be.
Maybe so. And one other benefit of hydroxyapatite is that the calcium and the phosphate, they will form a white crystal in the tooth. And the tooth will be smoother, so it's going to make the teeth appear whiter. So there is a whitening effect with hydroxyapatite as well.
Really?
And it's low abrasion. So you're not
Wow.
scrubbing the enamel off of your teeth.
Should you use a hard toothbrush or a soft brush?
A soft brush. And they even make extra soft toothbrushes too.
Okay.
Because you don't need to scrub. You need to do circles around the gums, around the teeth to remove the loose plaque. If you have hard deposits on your teeth and you're trying to scrub that off, that's a job beyond a toothbrush. That's when you need to have scraping
Sure.
with dental instruments by a dental professional.
Do you like the electric toothbrushes?
I do. I love the electric toothbrushes. Oral-B, Sonicare, Burst. Burst is what I carry in my office. Burst. And I love Burst because they will mail you a new toothbrush head every 3 months to remind you to change your toothbrush head. Because
love that.
how many people don't change their toothbrush
A lot.
after 3 months?
A lot.
Yeah. Or if you've been sick, with strep throat,
Yeah.
and you toss your
Yeah.
toothbrush, get a new brush.
Very important. I tell everybody
Yes.
that. Should tell them.
Yes.
So what's the name of it again?
Hydroxyapatite.
No, not
Oh.
the name of the brush that you like.
Burst.
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 So you can get those in your office. Do they also have the vibrations that may help with the ultrasonic
They
type?
do.
Okay.
That will vibrate the plaque off
Yeah,
the
so
teeth.
that really does work.
When I use a Burst toothbrush, I feel as if like my car going through a car wash, all the different brushes going in different
Really?
directions. That's how I feel like my mouth
next one's
feels.
I'm going to have to get that.
I'll get you one.
What about these devices you put I see it on the internet all the time. These advice you put in your mouth instead of brushing, it just does it for you automatically.
It's the lazy man's toothbrush, isn't it?
That's what it sounds like. Does it actually work?
I don't know. I feel like you have to have that mechanical action
That's what
to
I
remove
think.
the plaque.
I don't see how it could work. Plus, it seems like it'd be
Yeah.
uncomfortable sitting in your whole mouth.
It's not anything that I've recommended to my patients.
Interesting.
And something else too about the hydroxyapatite is that if you swallowed a whole tube of it, it's safe. So that's why for children, it might be a better option if your child isn't good at spitting their toothpaste
Yeah,
out.
it sounds like a really good option to me.
Yeah,
That
and
is-
that's why you have kids' toothpaste, and then at a certain age they can move up to an adult toothpaste, but the kids' toothpaste doesn't contain fluoride.
Is this widely known among dentists that you can use this hydroxyapatite?
I think it's new. I'm seeing more products with this ingredient in it. I still think because gold standard fluoride still taught in dental schools. Yeah. Dentists are leaving dental school still with a fluoride mindset. Mm-hmm. And, if you're willing to look outside the box and just see what else is available, especially when your patients are telling you, I don't want to use fluoride. Yeah. And so I feel like it's my duty. Well, what else can I offer them that's going to help them to have stronger teeth?
I love that. The fact that you look outside the box is very encouraging to me because people want options. People research things and they kind of make their own mind up. Mm-hmm. And I think that's really something that's good. It's a good thing. It means they're thinking about their health at least and just not accepting everything.
Right. And many of my patients that I do see, they are very health conscious patients. And, many of them come to me because they do hear that, we test saliva and we're comprehensive and we have a wellness centered practice. And so this is, this has been great in my practice.
I bet you're way ahead of the game. What about one more thing I know we talked about a lot? What about biologic dentistry, with the people that will take out your fillings? That's a whole nother subject that we'll talk about another time, and do it without getting the mercury in your system. Mm-hmm. Is that something that's a big thing, or
it's not around our area? Now, I go to a lot of continuing education all over the United States and meet dentists that are in these pockets where they are using measures to make sure that no mercury vapors are being released into the air, protecting both the patient and the dentist and the staff. I have seen people wear full-on hazmat suits with suction openings that are this large, covering the whole patient's mouth. I think there's a place for that.
Like if they just have a ton of amalgams or what?
Yes. But we use high volume suctioning, and there are rubber dams that you can even put over teeth as well and clamp around the tooth so that less of the amalgam will get into the patient's mouth and they would swallow the particles.
I have had patients tell me that after they had it removed with a regular dentist, they felt horrible. Mm-hmm. And I've had a lot of people that had them removed and say their overall health improved. So there may be something to it. I know you don't put that in there anymore. You don't put mercury in there anymore. Right. When do they stop putting mercury fillings in?
So I graduated from dental school in 2004, and we were still placing amalgam then for our boards. Mm-hmm. Okay. And as far as I know, in dental school, amalgam is still being taught. But I do not personally know many dentists that are placing amalgams. Now, you might see it more in pediatric dentistry, but I'm not speaking for the pediatric dentists as to what they use. But sometimes if you cannot keep a tooth dry because the white tooth-colored filling material, you have to put that in the tooth with the tooth dry. And if you have a child or that can't, you can't keep the cotton down where it needs to be around the tooth to keep everything dry and they're wiggly, or even an adult in that situation, you have to determine what's the best material for this particular patient. You know, it's not a one size fits all. You really have to consider what is going to be the product that I put in a patient's mouth that's going to last the longest.
Mm-hmm. That is so interesting to me. Dentistry is complex. It really is.
It is.
I mean, you're on top of everything. This is what I love about talking to you. This has been amazing. I didn't know all that history about fluoride, and this new hydroxyapatite really kind of gets me going. That's what I want.
Mm-hmm.
And I think if I ever have grandkids, I should be having grandkids soon. Here I'm almost 70 years old, 3 kids, no grandkids. It's time to have some grandkids. I think I want to encourage them to maybe on the hydroxyapatite part of it.
Right.
But this has been fascinating. I mean, we've covered a lot of dental subjects. What else have you got in there that we want to talk about?
We've covered, everything about fluoride and hydroxyapatite. I do want to say that many studies have shown that the remineralization of the tooth is the same in both hydroxyapatite and fluoride. So I don't think you can say that one is more effective than the other, but the takeaway is make sure the fluoride is regulated, that you're not drinking or not putting a whole tube of toothpaste in your mouth, and that you're using it in appropriate dosing.
Mm-hmm. Mm-hmm.
But I think hydroxyapatite is going to be something patients are going to be asking for more often.
That's new age to me. It's
right.
I would definitely be a taker of that without a doubt. But wow, this has been something else. Dr. Susan Creech, we're going to put your website and contacts on here. But and maybe a picture, those pictures of the tooth and the other thing. I really like that. I never realized about the pores that were in your mouth and in your teeth, and that's how you plug them up like that. But I do want to get you back. We're going to talk about oral cancers soon. We're seeing more of that.
I'd love to talk to you about that.
We will come back and have Dr. Susan Creech talk about oral cancers. And I mean, it's great that you're looking at all this stuff from a holistic point of view. And also, I know you feel on the neck, and you really do a very complete exam. And that's really important because you pick up on a lot of pathology. I've seen it because you send it back to me, and then we have to look into it a little bit further. But
and I even have an oral cancer device that I use. It's a light, a special light that I use with a filter, and that's how I do the oral cancer exam. But I got to save that for next time.
Wow! Even
so
like
stay
the
tuned.
Tongue? You look at the tongue a lot.
I look at about 12 different points. I have a worksheet that I go by, and I mark each area as I look.
That is fascinating.
Just to make sure that I've covered everything.
My tongue biopsied one time.
Did you?
Yeah, it was a result of COVID tongue. Have you ever heard of that?
I have.
I had a case of COVID. Did fine, except it left a really irritated spot on my tongue.
I'm still seeing effects in the mouth from COVID. Red dots on the tongue, and
really? That is so fascinating. I think some people have real sensitive mouths too. Some people can't tolerate certain substances in their mouth.
Spicy
I'm
foods,
one of them. I mean,
tomatoes.
my mouth will be set on fire if I eat certain things.
Right.
I mean, it's not normal. But this is fascinating. We'll talk about oral cancer really soon. I'll get you back.
Would love to.
Dr. Susan Creech, thank you so much. This is the most fascinating dental experience that I've ever had, talking about fluoride and this new hydroxyapatite. I'm really pumped. Thank you so much.
Thank you for having me.
And we'll see you guys next week.